you very much. I would like to go to the load of telemedicine, but I would like to unpack the situation of Corona a little bit more to give a little bit of context of why this is the problem which cannot be solved by usual transactions of healthcare. By transactions, I mean just meeting a patient once and giving them all the advice. I see it as a transaction. But what happens before and after that is something which you have to think about. So the one thing which is different from any other situation which we generally face in healthcare is that COVID-19 is a constantly changing process. It's evolving very, very fast. There's a new information which is coming up. There's a new treatment which people are looking for. So which means for the first time we need telehealth digital solutions which can adopt on hourly basis. We are not in that static kind of environment from all the perspectives, whether it comes to patient education or patient tracking or all the different aspects I need to evolve very, very fast. That's one part. The second part is we have to, our physicians are burning out, which means like if they are left with all the heavy loading for all the problems, it's the traditional model of again connecting doctors to patient is not going to work. The systems have to take care of a lot of the things for doctors and leave them to do things which they are supposed to do. And third problem is how do we quickly bring in the new workforce, which means like doctors who may have been retired, when they are required. Because the one thing which we have seen in examples of both USA and Italy, that 20 to 25% of the clinician workforce which is serving the people gets infected. So we end up with this compounding problem where the problem is getting the bigger and bigger, but the number of doctors are also shrinking. So this is to give a little bit more systemic view to the problem, and then let's look at the solution. So one thing which is required in the solution, first, the solution has to be something which is hand holding the problems and the patients on daily basis. It cannot be something which is you meet the doctor and then you go away and treat it at your home. It requires constant hand holding. The second part is we have to manage the patients holistically, because one thing which we are also learning is even if people are dealing with COVID, the mental health issues which are cropping up of people being in isolation. So again, that one dimension of healthcare, doctor to patient, doesn't really work. And third part is the constant engagement and alignment with the doctors. So these are the three things which are required from the telehealth solutions of today to work with the patients. And that's something which, and day to day we have been doing, and we have been working with the governments across the world to help them manage people in these situations.